Okay, this is going to be lithotomy draping and also pelviscopy draping. So when I do lithotomy draping, that's when I need access only to the vaginal perineal area. So our first sheet that we put on is called an under the buttock sheet. So it looks kind of like a Mayo stand cover, but it's just one thickness. So it's going to have a place for you to put your right and your left hand, just like we did on a Mayo stand cover. Okay, and that way your hands are protected. Because when I come up here to my patient, there's lots of areas where I can contaminate myself. You have the patient's legs, you have their hands that are at the sides, the bed, lots of things that you can contaminate yourself on. So make sure that your hands are protected inside that cup. So when we place this underneath the patient, you're just going to slide it underneath their buttocks. If you struggle, you can have an unsterile person come around and pull on the back side of that drape as well. If you do have a larger patient, it's very difficult for you to get it underneath. But make sure you back your hands out so you're not going to touch any of these unsterile areas that are out at the sides. Then your surgeon may or may not place some triangle towels. It's going to be their preference as to whether they want to or not. But these, we open up a blue towel, grab opposite corners so that we have two triangles that overlap on top of each other. And then we're going to place those so that they square off the vaginal perineal area. So we have one on one side and one on the other side. Okay, so again, grab the opposite corners, making those triangles that overlap on top of each other, and then position each of those on the sides of the vaginal perineal area. All right, then we're going to have two leggings that cover the patient's legs that are positioned up in stirrups. So as you look at this legging, it has a place where you're going to insert your right hand, and then this is a picture of a toe, which is going to be this top edge of the drape. It's like a sack that goes over the patient's leg here. So you put the hand on the inside, you grab that toe with the thumb and the first finger of the left hand, and you're going to open up that drape and then come back inside that opening. So you give yourself a large opening, but making sure that you still hold on to the back side of that toe so that it's not going to drag and drop on the floor. Then we start to slide it onto the leg, making sure that you catch all the bars of the stirrup. And then as you start to open it up, you want to make sure that you hold it high enough that you're not going to be dragging this edge all along the patient's leg, because this edge is going to be right up beside where we're going to be making our incision. So make sure that you hold it up and then slide it the rest of the way on, coming all the way up, and then still leaving that edge kind of folded back there. All right, on the next one, we do the exact same thing. So we put the hand inside, you grab the toe, you open it up. Okay, come back inside the cuff, kind of pinch it and give yourself that large opening so that you can approach the stirrup. Hold it up. As you get it started, then you're going to open it the rest of the way up and continue to slide it the rest of the way onto that leg. Okay. Now, the final sheet is going to be what we call as a lithotomy sheet, or sometimes referred to as a T sheet, because it literally looks like a T. It has a portion that goes over the patient's abdomen, and then a portion that comes down between the legs. Now, if you're draping with somebody else, you're going to hand it to them. The portion that's exposed first is the portion that goes down between the legs. So we're going to cup our hand and just extend that portion down. And then we have the portion that's going to cover the patient's abdomen, and that comes up. So you can see that that fenestration just exposes the vaginal perineal area. Now, if I needed access to the abdomen and the vaginal perineal area, instead of utilizing the lithotomy sheet, we're going to utilize what's called a pelviscopy sheet. And we're also going to square off the abdomen, just like we did when we were doing laparotomy draping. So if you're draping with somebody else, they might put the square off towels on the other side. Okay, so again, we open it up so the fold's away from you, cuff your hands, place that towel, and then we place the top and the bottom towel. Now, we may not place a towel down here because we don't want it to hang down over the vaginal area. If you do choose to put a towel here, you kind of fold it in thirds, so it's not going to occlude that area. On the pelviscopy sheet, you're going to look for the head towards the head, the foot towards the foot. Again, if you didn't know, you could ask your surgeon if they want stickies on or stickies off.
Stickies on.
Okay. You're going to split it in half, hand it to the person that you're draping with. Again, the portion that's going to be exposed first is the portion that goes down between the legs. So we grab this section, and it comes down to expose that vaginal perineal area. And then this one happens to have armboard covers on it, so you're going to open those up. We keep our hand up here at the fenestration, and then we would wait while our anesthesia provider is going to attach that drape to the IV poles. We don't want to let it fall to the ground, because then they would be bringing it back up to that sterile level. So you can see that it has the opening down in the vaginal perineal area, and then of course it has the opening up here on the abdomen as well. And then it's got a flap that's going to be occluding the area where we're not working, because we actually have two different wound classes here. So you're gonna have a clean abdomen and then a clean contaminated vaginal canal. So whenever we're not working on those areas, we wanna make sure that that area would be isolated. So usually they'll put in the uterine manipulator and then we cover that area and then perform such a case as the laparoscopic case up here above after that uterine manipulator has been placed.